Hello, everyone. This is Dr. Garima Sharma. I'm the center head for Apollo Fertility Thane, Mumbai Center. So I hope now all of us must be in a rewind of 2021 so as to have a little better attempts in making and improving our mental and physical health in the year 2022. So today I chose something little different from the conventional topics that we have been discussing all this while. If you could just excuse me for a minute and I will start with my screen share. And this is what we are going to discuss. So, all this while we were listening to infertility, what is infertility, causes, what are the different treatment options, newer modalities in treatment. But sometimes, have you really pondered over this question that do you really need to think something or do you really need to know about something before you delay your pregnancy? So there are a lot of things that if you look at my this slide that what all I'm going to cover, that these are the topics or these are the points that you should be knowing before you plan to delay your pregnancy. So we are going to look at the impact of age on various parameters like what your egg reserve is, the sperm factor, the status of the uterus. Are there any medical conditions that come up with aging? Or there is any impact of age on the pregnancy, 9 months of the pregnancy care or postpartum period? Very important point, which I think, what is the long term impact on a child's psychology if you are planning your pregnancy little late? And is there really any option where you can preserve your fertility and delay pregnancy at the same time without having any complications? So, this is something interesting. This was the first page headline of Times of India dated on 25th of November 2021. And it said that this is for the first time India has reached a level where the fertility rate is below replacement level. इसका मतलब क्या था simple words में that the government of India was trying to tell that infertility is now an epidemic. 2 साल तो कोविड में निकल गए but we are not thinking about fertility or infertility as a problem which is also sitting with us and we have to decide what are we doing. So this in general will tell you that if a couple comes down to my clinic and asks me, doctor, अभी हम प्रेगनेंसी के लिए रेडी नहीं हैं, कुछ ऐसी चीजें हैं जो आपको पहले से टेस्ट करना है या कितने टाइम के बाद हम अपनी प्रेगनेंसी प्लान कर सकें. So basically what I tell them is that it is a good idea that you do a fertility potential assessment. So आप कैसे हर साल annual health checkup करते हैं? Similarly, it is a good idea that you see where do you stand as a couple from the fertility perspective. Now, in case your age, that is of the female, is less than 35 and her ovaries are working well, that is her egg forming capacity is good, the husband semen parameters are fine, uterus is in a good situation, the fallopian tubes, that is a place where the sperm and the egg meet, that is also fine, and there are no medical issues with the couple, then probably you can delay your pregnancy, but with a word of caution that at regular intervals, you kind of have a regular checkup from your reproductive health. Now, this was something very interesting that we all know age impacts female fertility more than the male fertility. And uska simple rationale ye tha that as and how we advance in age, our egg forming capacity in quantity and quality it reduces. Now, ऐसा कोई मैजिकल नंबर है जिस पे हम बोल सकते हैं अच्छा अभी अलार्म बेल बज गया and now you have to start planning for the pregnancy, whether it is 35, 40, 41, 51. Unfortunately, there is no age, defined age, that beyond this is the red signal and before this is the green signal. And I really wish we could have had this kind of a smartwatch which could have told us that how many eggs are there in the system. Now, this is a very, very simple thing where you see that a female, she's born with a fixed number of eggs. And as in how she ages, the egg number declines both in quantity and quality. And अगर आप यहाँ पे देखें that between 30 to 40, ये जो decline है, that goes very sharp. Now, what is interesting? that we had earlier a concept that the fertility declines post 35. Now, Indian females, in comparison to the Western population, they can show ovarian aging as early as even 30 to 32. It is also very important कि ये जो rate of decline है, that is going to be different for every woman. Now let's say I have 3 women with me. किसी एक लेडी का तो आप 38-40 पे भी देखेंगे सिचुएशन वैसी है जैसे 20s में थी. There's a second lady who will start showing a decline at 35 as was expected. And there is a third lady who has a decline at the age of 31 and you have no reason for it. So it is very important to assess your reproductive health. You yourself are unique. You cannot compare your body with someone else's body. So in case you are planning to delay your pregnancy, then there are options to conserve your fertility, or you can have every 6 months or every 1 year, you can have a check on your egg reserve or the egg forming capacity. Now, as and how the egg forming capacity decreases, what does it come with? There are 3 things which I have discussed in my earlier talk also. One, the fertility chance or the pregnancy chances are low. Secondly, there could be a possibility of a miscarriage. And the third, there could be a possibility of a genetic issue to the child. ये जो second and third चीज है, this happens because as in how age advances, the egg quality declines. And this poor egg quality leads to genetic issues and that leads to miscarriage. So if you see here, at 30, your average chance to conceive in a month is about 18 to 20%, which reduces at 35 to about 10 to 15%. And post 40, it is less than 2 to 3% a chance for a natural conception in a month. Again, bottom line एक ही है that this is not applicable to each and every woman. Every woman is going to be different. So from 30, it is a good time to start making a decision in your life. When are you planning your pregnancy? If you're going to delay pregnancy, have possible solutions कि आगे जाके कोई complications ना आए. If you look at this, again, the miscarriage rate, it starts increasing as in how you age. तो 40 के बाद तो almost 50% chance है that you might have a miscarriage in the first trimester. And if I look at the genetic abnormality, at 40, almost 60% of the pregnancies can have genetic issues. Now, with this egg factor, we shift our focus to what is happening with the male. ये तो हमें पता है that males can still have, father a child even at 45 to 50 because उनका जो bank reserve है of a sperm production, so it's a production ejaculation, so it maintains a sperm count for a longer duration. But still, it is important that post 40, we see that the male hormone, that is testosterone, it reduces. And now these males come to us that they find difficulty in erection, they find difficulty in ejaculation, which can come with its own set of fertility issues. Also post 40, because इतने सारे lifestyle changes आ जाते हैं, you have a lot of stresses, you might also have medical issues, the sperm count, motility, and the shape or the morphology also decreases. Now, if you look at this, with age post 40, there are also chances of diabetes, obesity, and hypertension. And ये सारे issues थोड़ा सा male component में इनका incidence ज़्यादा रहता है. And all these factors negatively impact the sperm quality. Also, over the years, there are some males who have a habit of smoking, and long duration of smoking will again come with its negative impact. So, इसका solution क्या है? That you have a basic semen analysis, get the sperm count, motility, and the morphology checked. And if you are planning to delay your pregnancy, keep a check on it on a yearly basis. The third thing which is important from a pregnancy is the womb, the place where a child is going to grow for good 9 months. So again, with aging, there come certain conditions, जिसे हम scientific terms में बोलते हैं, like adenomyosis or fibroids. इनकी problem ये है that one, they reduce the implantation. Implantation is, that is the embryo which comes and sticking to the uterus, implantation rate थोड़ा कम हो जाता है. And secondly, during pregnancy, they come with certain complications like increased chance of a miscarriage, or there could be chance of a delivery before term, or increased bleeding during your delivery. The next important parameter is your fallopian tubes. So this is that site where the egg and the sperm they fuse to form a baby. तो अगर आपकी पहले कभी हिस्ट्री है कि कभी ट्यूब में प्रेगनेंसी रुकी हो, जिसे हम एक्टोपिक प्रेगनेंसी कहते हैं, या रिपीटेड वेजाइनल डिस्चार्जेस और वेजाइनल इन्फेक्शन है, या फिर देयर हैज बीन अ हिस्ट्री ऑफ अ ट्यूबरक्यूलोसिस, ऐसी सब सिचुएशन में इट इज बेटर दैट यू गेट योर ट्यूब्स assessed and we are ensured that tubes are open and you can postpone your pregnancy. Now till now we have discussed that what is the impact of age on reproductive parameters. Now the next topic is that age also comes with certain medical issues. That is कुछ medical conditions जो age के साथ हमारी body में दिखना शुरू होती हैं and जिनका हमारी fertility and pregnancy पे negative impact होता है. To name a few, we talk about diabetes, blood pressure issues, heart issues, obesity, mental illness, and even cancer. If you look at a diabetes statistic, Indians they get diabetes on an average 10 years earlier than the Western counterparts. And again, diabetes comes with its own set of issues. On the male factor, it declines the sperm quantity, the motility, as well as the quality. Long-standing diabetes in females affects the egg quality. It again comes with its own set of pregnancy complications. So a good HbA1c, so HbA1c एक blood test parameter है जो हमें बताता है that over a period of 3 months हमारा sugar control कैसा रहा है. So a preconceptional HbA1c test showing a value of 6.5 or less than 6.5 is a good time frame to plan your pregnancy. Now, if we look at this, then having diabetes during pregnancy has a negative impact both on the mother and the child. In case of a mother, there is a higher chance of also developing blood pressure issues during pregnancy. And there is also possibility that post-delivery, you might have or you might continue with the diabetic situation. In case of a child, right from the first trimester till the child is born, there are a lot of issues in terms of development of the child is affected. There could be a chance of a miscarriage. There could be a chance of a very heavyweight baby, and because of which there might be a need of a C-section. As far as baby is concerned, post-delivery, baby sugars could also decline. So you can see that there is a whole basket of adverse effects in terms of diabetes to mother and child. So you have to be very, very particular while delaying your pregnancy in knowing that these things can come post-35. Blood pressure is again another issue. Of course, male incidence thoda zyada hai, but any blood pressure concern to the female will also come with its own complications during the pregnancy. Mental illness. I think the third pandemic or the epidemic that apart from COVID and infertility we are dealing with, and in a larger picture, is mental illness. Professional stresses, personal stresses life में कभी कम नहीं होने वाले. There's no person who can say मुझे stress नहीं है. But how much is this stress? What is the duration of this stress? And does this stress really impact your pregnancy? Yes, there have been studies which show that a long-term stress and anxiety over a period of time increases your chance of a preterm birth, low birth weight baby, and also the growth retardation of the baby. And India, if you look at this World Health Statistics, almost about 7.5 to 10% of Indians are suffering from mental disorder and likely to be depression or anxiety, and which over a period of years piles up. So therefore, you have to really be very vigilant that at 40, there's going to be no situation where you can say, now I'm settled, so my stresses are less, I can delay my pregnancy to that stage. This was a very important picture or a slide, which in totality gives that if the mother's age is advanced, are there any concerns? So we see that there are concerns right from a pre-pregnancy planning to 9 months to the post-delivery period. In a pre-pregnancy planning, you can have issues that your fertility potential could be less. You might need treatments like IVF or advanced fertility treatments. During your pregnancy in the first trimester, because of the advanced age, the egg quality could be low. There could be a genetic issue to the child, or there could be increased risk of miscarriage. During your second or the third trimester, there could be issues with diabetes, with blood pressure, preterm, that is before term delivery, need of a C-section, bleeding during pregnancy. And post delivery, again, there could be increased episode of bleeding, lactational issues, and increased incidence of postpartum depression. So if you look, you don't want to have this kind of a picture when it is the most important phase of your life. So the bottom line is that you have to be very vigilant, you have to plan your pregnancy, and you should be knowing that what could be the outcomes of delaying the pregnancy. This was something very interesting that I found out while searching for what could be the impact on the parents when they plan a pregnancy at a little age, and what could be the impact on a child. So there was this concept which I found out, sandwich generation. Now this is this group of 35 to 50 who have planned their pregnancy late, and at this age group they are looking after two financially independent group, that is their children and their aging parents. As a result of which, this boils down to having financial pressure, mental stress of taking care of your parents as well as looking after your child, and ultimately impacting your personal life. If I look into a child's scenario, let's say you have conceived or you have had your first child at the age of say 38 or 40. Imagine your child is going to be financially independent at about 30 and you yourself would be at 70. Rather than being a help to your child, you in turn might be a dependency to your child. So you remember our parents, they used to plan their pregnancies at 20s and 25s at the max. And when we were in that growing phase of our life, they were still independent. They were financially independent. They were taking care of us. So you always have to look onto your challenges when you start looking out for delaying a pregnancy. And you also have to look what your child's age would be when you would be at 65 or 70. So, having said this is nothing to bring fear to you all. We have some beautiful options where, because of any constraint, be it your professional stress, your financial, or your personal issues, you cannot afford a pregnancy and you want to delay the pregnancy, but you do not want to come across these side effects. Then, egg freezing and embryo freezing are a very good concept to preserve your fertility and postpone pregnancy. Egg freezing is nothing, it is just that we, through a process of similar to an IVF, we stimulate the eggs of a girl, we take out these eggs and we preserve them to be used for up to 10 years. So egg freezing is generally for single girls who do not have a partner at this point of time. Embryo freezing is an option wherein it's a married couple and you want to kind of postpone your pregnancy. So you create embryos and you freeze them for maximum up to 5 years to be used for a later option. So, in the end, I would like to say always make decisions that prioritize your inner peace. So, always plan your personal and professional lives. Always plan your personal and professional lives. Always be very well planned that how your next 20, 30 years are going to be in terms of child bringing, taking care of your parents, as well as taking care of yourself. Thank you. And I'm now very much open to any questions that we have. So we have a question. Do we get any suggestions from our fertility consultant as well as doctor? Yes. So interestingly, I had captured in my previous Facebook Live a concept of preconceptional counseling, and this is what I was talking again today. That is, whenever you are in a situation when you are still not fixed on whether you want to plan a pregnancy or not plan a pregnancy, it is a good idea to meet a fertility consultant or a gynecologist, discuss your concerns, discuss your plans, get yourself evaluated from both the things, that is from your overall health status and from your fertility potential, and then look out for options that till what time are you planning to delay the pregnancy. If it is just 1 year delay, all parameters are fine, well, everything is okay, you can come back to us and plan a pregnancy a year later. However, if you are planning to have a delay for more than about 4 years or 5 years, then you can discuss options of egg freezing and embryo freezing with your consultant. How to maintain a healthy lifestyle. I think there's an entire talk on maintaining a healthy lifestyle, and I can talk on hours about this. Well, my three mantras of maintaining a healthy lifestyle are a clean diet, an exercise, and a stress management. And when I talk about diet, I have been a very staunch proponent of an Indian diet. You know, the Indian thali in itself is a balanced nutritional diet. With our stresses, our major concerns is one, we lose the discipline of eating, maintaining a time interval. And at the same time, the interval is more, we resort to easier options by looking forward to processed food, junk food. So if you maintain a discipline and a healthy home cooked diet, that is more than enough from a diet perspective. You need not go in for fancy dieting concepts to lose weight. The second concept is to have a active life. I think 30 minutes is possible for all of us. So 30 minutes of a physical activity, anything. You know, you go out for a walk, you do cycling, you dance, you do Zumba, swimming, anything that gives you a soothing effect is something which will keep on moving your body actively and have a good effect on your all the parameters of the body. Third is stress. There is no way you can say goodbye to stress. I am away or I do not have stress. The question is, how do you manage stress? Simple breathing exercises, meditation, pursuing your hobbies for just 15 minutes every day keeps you away from the stress. So these are the three components and which requires consistency over a period of time to maintain a healthy lifestyle. Someone has asked me if I have frozen an egg, by what age should we undergo the process and what would be healthy age? The sooner the better over here. So what we were discussing is that as and how the age progresses, you know, you see a decline in the egg quantity and quality. Now, there is no fixed age definition that can say that, okay, you get this procedure done at this point of time. So, what I educate people that around 28 or 30, whatever stage of your life you are, married or unmarried, set your goals. By that time, you know that, okay, when are you looking forward to a pregnancy? If you're looking forward to a pregnancy in a year's time frame, then it is better you get your egg reserve checked. Everything is fine, plan a natural pregnancy. If not, then the earlier, at whatever age, you know, 30s, 31, 32, you get your eggs frozen because these eggs can be frozen for up to almost 10 years. If you plan, again, there is no definition. We can't say that at 37 I can't preserve the eggs. The only challenge here comes that because we get lesser number of eggs and the eggs could be of a little poor quality, so you might need 2 or 3 rounds of stimulation to have that decent number of eggs frozen with us, which can be used for long term. Then someone has asked me, alcohol or smoking can affect the body. But if we come clean in the right time, how much time will it take to heal our body completely and make it ready for fertility? Now, first of all, if you have been into either of the partners, that is the male or the female, you have been into a long standing alcohol or smoking, the first step is that we have to get rid of this effect. And secondly, at this point of time, you see what how much negative impact has it done on either the semen parameter or on the egg parameter. Now, based on the insult that it has caused, the damage it has caused, then you need to discuss with your fertility consultant, you know, what are the ways of improving it? Stopping smoking, coming to a healthy lifestyle, monitoring your parameters frequently, and planning your pregnancy. Or if you have come to such a situation where the damage has been too much or it has become kind of irreversible, then you might need to resort to an advanced fertility treatment also for achieving a pregnancy. So if I find that I have PCOD at a later stage, what ways can I choose to have a baby? Again, it depends on the profile that how were you diagnosed with PCOD? What is your age at this point of time? And how badly the PCOD has affected your reproductive potential. So main challenge with the PCOD is that it impacts your egg quality. Secondly, it interferes with your ovulation and egg growth. And third, a very long standing kind of a PCOD might increase your chances of miscarriage. So, if you are a borderline PCOD, a healthy lifestyle, and quickly starting with your fertility management with follicle tracking, pinpointing onto your ovulation window, and covering up on those days. If you are a very strong PCOS, then some kind of a medical management so that we can bring down your hormones to a little normal level, and then we start looking for your ovulation window and plan your pregnancy. However, it is important that while we are doing this, we also look out for other fertility factors, because you said that it has come to a later age. So I would be also looking at what is the semen parameter, what is the uterus situation, what is the fallopian tubes. That is, I'm dealing only with PCOD or I'm dealing with two, three factors. So at this point of time, it is good to get evaluated the severity, look out for the other factors, and consult with your doctor to look out for options. According to your doctor, what should be the year gap between first and second baby, considering mother health and planning? We generally say, the family planning guidelines of India say a good gap of 3 years, but a bare minimum of 2 years is an ideal gap for spacing out the two pregnancies. Someone said that she's 34 year old, has a baby girl. At this stage, she wants a second child, but is also confused about whether my body can take it. Okay, so our bodies have mothers. God has given us so much of strength that carrying a child, taking care of the child, is really not an issue. At 34, our main concern is not from your health perspective. So main concern is that are we seeing any signs of ovarian aging? So to first of all, to know where you stand, it is a good idea to get your routine health checkup in terms of your hemoglobin, your thyroid, sugars, vitamin levels, to see your pre-pregnancy health status. And secondly, look out for your fertility potential markers. If everything is fine, this is a good time you plan your pregnancy with the help of some gynecologist or a fertility consultant. So I think with this, we are done with these questions. I thought that to break that flow from fertility management and treatment, this was very important, because a foundation or a base is very important. You should know. I see a lot of couples coming to me at 38 and 40. That doctor, we were so stuck in our professional lives. Unfortunately, at that point of time, we were not educated about all these parameters of reproductive health. Would we have known about options of egg freezing and embryo freezing, we would have not been seeing this situation. So my idea of this entire series of talking about preconceptional health, knowing about the consequences of delaying the pregnancy, is just to educate you people all that there are different options available, and it is good that you plan everything. So in your professional careers, how do you plan? You plan your quarters, you plan your quarter growths, you do regular audits to check your success failures, and then you again improvise, or you plan out that why did you have a failure. So I think your personal lives, having a child, your reproductive health also needs that kind of an attention, and we as fertility consultants are sitting there to help you with any and every question that you have, with different options available. Thank you, everyone. And I'm wishing you all a very happy new year in advance. I wish this 2022 is free of COVID. It comes with joy, happiness, and positivity for all of us. Thank you. Namaste.